So your doctor finally orders some advanced heart labs like ApoB or Lp(a), but you got a bill for $300. You are confused, you're frustrated, you're thinking, wait, I thought this was preventive care. Why isn't insurance covering this? Well, today we are talking about why advanced cardiovascular tests like Lp(a), ApoB often are not covered, and the situations where they actually are. And more importantly, how you can use this knowledge for your advantage to protect your heart without draining your wallet. 50-year-old tech engineer came to see me last year. His cortisol was normal. His BMI was only 25, but his dad died of a heart attack at the age of 52. So we ran advanced cardiovascular panel. We ran ApoB and Lp(a), two of the most powerful risk markers in preventive cardiology. Without a surprise, his Lp(a) was 160, triple the normal level. We caught a silent risk that could have changed his life trajectory. But a week later, he messaged me and said, "Doc, why did I get a bill for $300? Let's break down why this happens and what to do about it." Stick around. Most insurance companies follow standard clinical guidelines when deciding what they will pay for. So what they are covering? They are covering basic blood work, basic lipid panels like total cholesterol, LDL, HDL, and triglyceride, sometimes A1C and fasting glucose. In some plans, CRP, C-reactive protein, if there is an inflammatory condition. Why they only cover these tests? Because these are cheap and they are well established in the guidelines and often used to monitor known disease, not predict hidden risk. In another term in insurance language, medically necessary means after you already have a problem, not to prevent one. Let's be real. These tests are more precise, more predictive, and more actionable than old school panels. So why they are not covered? Well, there are several reasons. Reason number one, they are too new for broad guidelines. Even though studies support their use, many aren't yet part of the required preventive testing bundles in major guidelines, like United States Preventive Service Task Force or Medicare's annual wellness visit. Reason number two, they are risk stratification tools. Insurers argue these are only useful if you are already at intermediate risk, not for blanket screening. Reason number three, lack of provider awareness. Many doctors don't order them, so insurance doesn't get pressured to pay for them. And reason number four, cost containment. Let's face it, if everyone got tested early and started statins or imaging, short-term costs will go up, and some payers don't look at the long-term savings. Here is when I have seen coverage most likely. Let's start with ApoB. Covered only if the patient has a high LDL or a family history of existing coronary artery disease or statin use. Some Medicare Advantage plans include it in the lipid management. While for Lp(a), may be covered if this patient has a strong family history of early heart disease or personal history of premature events. Certain Blue Cross and commercial plans will pay for this once per lifetime. High sensitivity CRP or C-reactive protein covered in some cases with inflammatory conditions, known coronary artery disease, or when used to guide statin therapy, as known as Jupiter trial criteria. Triglyceride to HDL ratio, this is calculated, no extra charge. Insulin and HOMA-IR, homeostatic model assessment insulin resistance. Well, fasting insulin is covered if diabetes is suspected or being evaluated, while HOMA-IR often is not billed separately. Labs just don't code for it. ALT and AST and A1C and fasting glucose, these are almost always covered. Here is what I tell my patients. Number one, use the right billing codes. Ask your PCP to use the right billing codes, like strong family history of early heart disease, hyperlipidemia, insulin resistance, or metabolic syndrome. Check with your primary care physician. Number two, call your insurer first. Ask if ApoB or Lp(a) covered under my plan with a diagnosis of early heart attack, for example. Some insurance require pre-authorization. Most patients never know this. Number three, pay cash through a third-party lab. Some online labs offer ApoB and Lp(a) for $30 to $60 cash. It's faster, easier, and cheaper than going through insurance. Lastly, bundle tests during your annual physical. Labs done during your preventive visit may be more likely to get processed as covered, depending on the billing coding. So back to my patient. We resubmitted the claim with the right code. Family history of ischemic heart disease. Remember, his father died at the age of 52. And boom, it was covered. So when I explained to him, say, okay, your Lp(a) level could double your risk of early stroke or heart attack, and you would never know it from your standard labs. He said that $300 test might have saved my life. I would pay that 10 times over. So you might want to just pay cash for this test if you have a family history of early heart disease or sudden cardiac death, if you had a normal cholesterol panel but feel like something is off, or you are athlete or high performer monitoring longevity and peak health, or number four is having high triglyceride or borderline A1C with no clear explanation, or lastly, number five, just want to take your prevention game to the next level. Remember, one heart attack costs between $25,000 to $1,000. These labs cost only $30 to $100. So here's the bottom line. Insurance still lags behind the science. But if you use the right codes, ask questions, or pay cash, these tests can be accessible. And for many patients and many people, the risk they uncover is worth every penny. At Dr. Nony's Power Lab, we are not waiting for disease. We are catching it before it catches you. Like this video if it helped, subscribe for more no-fluff medical breakdowns, and comment below. Have you ever gotten hit with a surprise lab bill or found something life-changing through one of these tests? Waiting for your comments. Let's fight smarter and make prevention personal. Thank you and have a great day. Bye-bye.